My name is Stella Obeidi. I am currently an FMP and I work in a community medical center in an urban setting. Majority of my patients are underprivileged and my presentation today is my personal plan for innovation and leadership in the DNP role using PowerPoint talkover. In preparing for this presentation, I set out some objectives to guide me, and they include the background of the project, of my capstone project, priorities, my personal philosophy, my leadership style using Tom Kelly's 10 Phases of Leadership, my current strengths and weaknesses, plan to apply and advance skills in my capstone project and DNP role, and I will also discuss areas of opportunity to develop innovation and leadership qualities that are not presently my strengths and plan for creating those opportunities in the DNP role. Okay, starting with my background. My capstone project involves acute pain management in lower joint postoperative patients ages 35 to 85 years old, and I'll be focusing on the hip and knee joint replacements. And I'll be examining the effect of scheduled versus as needed analgesics in alleviating postoperative pain to encourage early mobilization, um, preventing complications, and early discharge from the hospital. Just a brief statement about total joint replacement, otherwise known as total joint arthroplasty (TJA) of the lower extremity, is one of the most common operations in orthopedics, with an estimated 1 million cases being performed in the United States annually. And most studies also stated that the pain after joint replacement surgery has often been inadequately managed. So this is a big concern. Again, I set some priorities to guide me in working on my project. They include clear goals, and I also set some values. I will establish and maintain trust among my stakeholders, and also clear and concise communication, very important. So what is my personal philosophy? My personal philosophy is preventing patient suffering and attainment of comfort through innovations. In addition, I'll be using some of the essentials of the DNP curriculum in my practice, and the some of them that I have found very important include scientific underpinnings for practice, leadership, clinical scholarship, evidence-based practice, interprofessional collaboration, information system and technology, which is innovation, very important. These I plan to use in my practice. So what is my leadership style? I will be a transformational leader and also an inspiring leader. As a transformational leader, I know the importance of using technology systems because technology changes every day. And as an inspiring leader, I have to educate my patient. I have to set clear goals, communicate with them clearly, and I have to lead by example by inspiring my team. So, what are my current strengths? I'll be using the three of the Tom Kelly's 10 Phases of Innovation as a guide. So, as a hodler, I am very always optimistic. I set goals, and I'm always optimistic that I'll achieve those goals, and I persevere in achieving those goals. I know that perseverance is very important to the hodler. And as a caregiver, I will guide my clients and team through the process to achieve our goals and patient outcomes. And as a collaborator, I am able to bring a group of individuals with different personalities together to form a very cohesive team. So, my weaknesses and areas of opportunity. I have several weaknesses. I'll be discussing four most important ones. I am a poor predictor of human behavior, so I'm a poor anthropologist. And I plan on working on this by learning and study people's behavior and developing a deep understanding of how people interact and why they do so. I'm also a poor set designer, a poor listener. I know this is very important that I have to work on this, because to be a good communicator, I have to listen. And also, I always expect the best out of people. My plan to apply and advance skills in my capstone project and DNP role. I also identify with three of Tom Kelly's 10 Phases of Leadership. So, as a storyteller, I know I have to. I personally I learn by visual examples. So I'll be using video, narrative, animation to educate the staff on evidence based outcome of scheduled versus as needed pain medication administration in lower joint surgeries. And also, as a director, I will direct and implement evidence based practices among the stakeholders, and in educating them, and also ensuring that they become advocate for this project among the surgeons, whom I already think will be the toxic behavior in this project. And as a collaborator, I'm able to bring a team together for the common goal, and that's relieving pain among lower joint surgical patients. So, areas of opportunity to develop innovation and leadership qualities. Communication, very important, clear and concise. I plan to get involved in healthcare policy and advocate for the poor. Um, I am currently an active member of California Association of Nurse Practitioners. I have slided a little bit because of schoolwork, but I plan to pick up as soon as I am done, and I plan to take a position to get involved. That is the only way we can move forward, uh, move our profession forward. We got to get involved in policy, especially healthcare policy, and also on a small scale within my establishment or facility, I will plan and implement quality improvement, and I'll get the nurses and stakeholders involved in doing this. In conclusion, I know the importance of effective leadership. It begins with me. I have to learn to be a good leader of myself, to lead others. And I know good leadership involves influence, taking genuine interest in my team, and also showing appreciation and respect for everybody in my team. And as a DNP leader, I strive to inspire and lead innovation to create a wave of change in the healthcare system. Like I said earlier, getting involved in healthcare policy and improve patient outcome. as a nurse, I will always be a patient advocate, and this will be a better position for me to do that. That's being a DNP prepared nurse. So thank you.